Question 1. A practical nurse, PN, is caring for a client who is newly diagnosed with type 2 diabetes mellitus. The client expresses anxiety about managing their condition at home. Which action should the PN prioritize? A. Refer the client immediately to an endocrinologist for specialized management. B. Provide a comprehensive list of all possible diabetic complications. C. Assess the client's current knowledge and readiness to learn about diabetes management. D. Advise the client to completely eliminate all carbohydrates from their diet. Answer: C. Assess the client's current knowledge and readiness to learn about diabetes management. This question focuses on client education and individualized care, highlighting the importance of assessing before intervening. The keywords newly diagnosed and anxiety indicate that the client needs tailored support rather than overwhelming information or immediate specialty referral. A practical nurse's priority in this situation is to first understand what the client already knows and what they are ready to learn, as this forms the foundation for effective and patient-centered education. For example, some clients may need basic information about diet, while others might be ready for insulin administration. Always remember to meet the client where they are, tailoring your teaching to their specific needs and readiness. Question 2. A client is admitted with symptoms of a urinary tract infection, UTI. The physician orders a urine culture and sensitivity. When should the practical nurse, PN, collect the urine sample? A. Immediately after administering the first dose of antibiotics. B. After the client has consumed at least 1 liter of fluid. C. Before initiating any antibiotic therapy. D. During the client's first void after waking up. Answer: C. Before initiating any antibiotic therapy. This question tests the understanding of proper specimen collection for diagnostic accuracy, especially for infections. The key instruction is for urine culture and sensitivity, which aims to identify the specific bacteria causing the infection and determine which antibiotics will be effective. Administering antibiotics before collecting the sample could alter the bacterial growth, leading to inaccurate results and potentially ineffective treatment. For instance, if antibiotics are started too early, the culture might show no growth, even if an infection is present, delaying correct treatment. Always prioritize collecting cultures before starting antibiotics to ensure the most accurate diagnostic results. Question 3. A practical nurse, PN, is preparing to administer an opioid analgesic to a client reporting severe pain. Before administration, which vital sign is most critical for the PN to assess? A. Blood pressure. B. Temperature. C. Respiratory rate. D. Oxygen saturation. Answer: C. Respiratory rate. This question addresses medication safety and the specific side effects of opioid analgesics. The most critical assessment before administering an opioid is the client's respiratory rate because opioids can cause respiratory depression, a potentially life-threatening side effect. While other vital signs are important, a depressed respiratory rate directly indicates a risk of hypoventilation and decreased oxygenation. For example, if a client's respiratory rate is already low, e.g., 10 breaths/minute, administering an opioid could further suppress it, leading to respiratory arrest. Always prioritize assessing the client's breathing when administering medications that can affect respiratory drive. Question 4. A client post-appendectomy is ambulating for the first time. The client reports dizziness and pallor immediately after standing. What is the immediate action the practical nurse, PN, should take? A. Encourage the client to take deep breaths. B. Document the incident and notify the physician. C. Assist the client to sit or lie down immediately. D. Administer an antiemetic medication. Answer: C. Assist the client to sit or lie down immediately. This question evaluates the PN's ability to prioritize safety interventions, specifically for orthostatic hypotension or syncope, which is common during initial ambulation after surgery. The keywords dizziness and pallor indicate potential fainting or a significant drop in blood pressure upon standing. The immediate priority is to prevent a fall and potential injury by helping the client return to a safe position, such as sitting or lying down, to restore cerebral blood flow. For example, if the PN doesn't act quickly, the client could fall and sustain a head injury. Always prioritize client safety by preventing falls when signs of dizziness or instability appear. Question 5. A practical nurse, PN, is reviewing the care plan for a client with chronic obstructive pulmonary disease, COPD. Which intervention is most appropriate for promoting effective airway clearance? A. Administering oxygen at 6 liters/minute via nasal cannula. B. Encouraging pursed lip breathing and controlled coughing techniques. C. Limiting fluid intake to prevent fluid overload. D. Positioning the client supine for rest periods. Answer: B. Encouraging pursed lip breathing and controlled coughing techniques. This question focuses on respiratory care for clients with chronic obstructive pulmonary disease, specifically aimed at improving airway clearance. Pursed lip breathing helps to keep airways open longer and improves ventilation, while controlled coughing helps to mobilize secretions effectively. Providing high-flow oxygen, option A, can actually suppress the respiratory drive in some COPD clients, and limiting fluids, option C, might make secretions thicker and harder to clear. Positioning the client supine, option D, can worsen shortness of breath. Teaching and reinforcing these breathing techniques empowers clients to manage their dyspnea and clear their airways. Question 6. A practical nurse, PN, is caring for a client with a new colostomy. The client is reluctant to look at the stoma or participate in its care. What is the most appropriate initial nursing action? A. Inform the client that participation is necessary for discharge. B. Demonstrate the stoma care procedure while the client observes. C. Provide written information about colostomy care. D. Ask the client about their feelings and concerns regarding the colostomy. Answer: D. Ask the client about their feelings and concerns regarding the colostomy. This question addresses therapeutic communication and emotional support for clients adapting to significant body changes. The keywords reluctant to look and participate indicate that the client is experiencing emotional distress or difficulty coping. Before providing education or forcing participation, the most appropriate initial action is to assess the client's emotional state and address their feelings, which builds trust and opens the door for future education and involvement. For example, if the client fears rejection, simply demonstrating care won't alleviate their anxiety. Always prioritize emotional assessment and therapeutic communication when a client expresses reluctance or distress related to body image changes. Question 7. A practical nurse, PN, is educating a client about proper hand hygiene. Which statement by the client indicates an understanding of the most effective technique? A. I should use an alcohol-based hand rub for visibly soiled hands. B. Washing my hands with soap and water for 5 seconds is enough. C. I should scrub my hands vigorously with soap and water for at least 20 seconds. D. I only need to wash my hands after using the restroom. Answer: C. I should scrub my hands vigorously with soap and water for at least 20 seconds. This question tests knowledge of infection control principles, specifically effective hand hygiene. The correct technique for hand washing with soap and water involves vigorous scrubbing for a minimum of 20 seconds to effectively remove transient microorganisms and debris. Using alcohol-based hand rub is inappropriate for visibly soiled hands, and 5 seconds is insufficient for proper cleaning. Hand hygiene is crucial not only after using the restroom but also before and after client contact, after touching contaminated surfaces, and before aseptic procedures. Remembering to sing "Happy Birthday" twice helps many people reach the 20-second mark for thorough handwashing. Question 8. A practical nurse, PN, is assisting a client with advanced dementia to eat. The client frequently coughs and pockets food in their cheeks. What action should the PN take to prevent aspiration? A. Encourage the client to eat quickly to finish the meal. B. Offer thin liquids to help wash down the food. C. Elevate the head of the bed to a high Fowler's position during meals. D. Provide large, infrequent bites of food. Answer: C. Elevate the head of the bed to a high Fowler's position during meals. This question focuses on safe feeding practices and aspiration prevention for vulnerable clients, especially those with impaired swallowing or cognitive deficits like advanced dementia. Coughs and pockets food are key indicators of dysphagia, meaning difficulty swallowing, and a high risk for aspiration, food or liquid entering the airway. Elevating the head of the bed to a high Fowler's position, 60 to 90 degrees, uses gravity to help food move down the esophagus rather than into the trachea. Offering thin liquids or large bites can increase the risk of aspiration, and rushing the client increases the risk of choking. Always position clients upright during meals to ensure a safer swallowing pathway. Question 9. A practical nurse, PN, is preparing to administer medication through a nasogastric (NG) tube. After checking the placement, what is the next essential step before administering the medication? A. Flush the tube with 60 milliliters of sterile water. B. Aspirate stomach contents to check for residual volume. C. Clamp the tube for 30 minutes to ensure absorption. D. Administer the medication mixed with a feeding formula. Answer: B. Aspirate stomach contents to check for residual volume. This question pertains to safe medication administration via a nasogastric tube. After confirming proper tube placement, checking for residual volume is the next crucial step. This assesses how much fluid remains in the stomach from previous feedings or medications, helping to prevent gastric distension, nausea, vomiting, and potential aspiration if too much residual volume is present. For example, if more than 200 to 250 milliliters of residual is found, depending on agency policy, holding the medication might be necessary. Always check residual volume before administering medications or feedings through an NG tube to ensure client safety and absorption. Question 10. A client with a fractured tibia is prescribed a plaster cast. The practical nurse, PN, is providing discharge teaching. Which instruction is most important for the client to understand regarding cast care? A. You can use a coat hanger to scratch inside the cast if it itches. B. Keep the cast elevated above heart level, especially for the first 24 to 48 hours. C. Apply ice packs directly to the cast to reduce swelling. D. It's normal for your toes to feel numb and tingly for the first few days. Answer: B. Keep the cast elevated above heart level, especially for the first 24 to 48 hours. This question focuses on post-cast application care and the prevention of complications, specifically compartment syndrome or excessive swelling. Elevating the cast above heart level is crucial during the initial 24 to 48 hours to promote venous return and reduce swelling, which can otherwise compromise circulation and nerve function. Using objects to scratch inside the cast can break the skin and lead to infection. Applying ice directly to plaster can cause dampness and skin maceration, and numbness and tingling are signs of neurovascular compromise that require immediate attention, not normal findings. Always emphasize elevation and monitoring for 5PS, pain, pallor, pulselessness, paresthesia, paralysis, with cast care. Question 11. A practical nurse, PN, is caring for a client experiencing an acute asthma exacerbation. The client is wheezing and reporting severe shortness of breath. Which medication would the PN anticipate administering first, based on common asthma protocols? A. Inhaled corticosteroid. B. Oral prednisone. C. Short-acting beta agonist, SABA. D. Long-acting beta agonist, LABA. Answer: C. Short-acting beta agonist, SABA. This question tests knowledge of rapid-acting medications for acute respiratory distress, specifically an asthma exacerbation. A short-acting beta agonist, SABA, such as salbutamol, is the first-line medication for immediate relief of bronchospasm due to its rapid onset of action in dilating the airways. Inhaled corticosteroids and oral prednisone are used for long-term control and reducing inflammation, while long-acting beta agonists are for maintenance therapy, not acute attacks. For example, if a client is having an asthma attack, a SABA inhaler will quickly open their airways, whereas other medications take much longer to have an effect. Always prioritize immediate relief for acute respiratory symptoms with a SABA. Question 12. A practical nurse, PN, observes a colleague accessing the electronic health record of a client they are not assigned to care for. What is the most appropriate initial action for the PN to take? A. Confront the colleague immediately and accuse them of a privacy breach. B. Document the incident and report it to the regulatory body. C. Speak privately with the colleague about the observation and the importance of client confidentiality. D. Ignore the situation, assuming the colleague has a valid reason. Answer: C. Speak privately with the colleague about the observation and the importance of client confidentiality. This question assesses the PN's understanding of professional responsibility, ethics, and communication related to client privacy. Accessing a client's record without a legitimate care purpose is a breach of confidentiality and a serious professional misconduct. The most appropriate initial action is to address the issue directly and privately with the colleague, which provides an opportunity for education and immediate correction before escalating to formal reporting, unless the behavior continues or is clearly malicious. Ignoring the situation is irresponsible, and immediate confrontation or reporting to the regulatory body without initial discussion might be premature and not the most effective first step for a colleague. Always uphold client privacy and address breaches professionally, starting with a direct, private conversation if appropriate. Question 13. A practical nurse, PN, is providing education to a group of older adults about fall prevention at home. Which recommendation is most effective in reducing fall risk? A. Keeping all rooms dimly lit to promote relaxation. B. Encouraging barefoot walking to improve foot strength. C. Removing loose rugs and ensuring adequate lighting. D. Limiting physical activity to reduce the chance of injury. Answer: C. Removing loose rugs and ensuring adequate lighting. This question focuses on environmental modifications for fall prevention in older adults, a critical aspect of client safety. Loose rugs are a common tripping hazard, and inadequate lighting can obscure obstacles, increasing the risk of falls. Dim lighting, barefoot walking, and limiting physical activity can all increase fall risk or lead to deconditioning. For instance, a small, unsecured rug in a hallway can easily cause an elderly person to trip and fall, leading to serious injury. Always prioritize creating a safe home environment by addressing common physical hazards. Question 14. A practical nurse, PN, is caring for a client receiving a continuous intravenous, 4, infusion. The PN notices swelling and coolness at the 4 site, and the client reports discomfort. What is the most likely complication? A. Phlebitis. B. Infiltration. C. Infection. D. Air embolism. Answer: B. Infiltration. This question tests the PN's ability to identify common fore complications based on characteristic signs and symptoms. Swelling and coolness at the fore site, combined with discomfort, are classic signs of infiltration, which occurs when the fore fluid leaks out of the vein and into the surrounding subcutaneous tissue. Phlebitis involves inflammation of the vein and would typically present with redness, warmth, and a palpable cord-like vein. Infection would involve warmth, redness, pus, and fever, while an air embolism involves acute respiratory distress and circulatory collapse. Recognizing these distinct signs is crucial for immediate intervention, such as discontinuing the fore and applying a warm compress. Question 15. A practical nurse, PN, is reviewing client assignments for the shift. Which client should the PN prioritize for initial assessment? A. A client awaiting discharge after a successful hip replacement. B. A client requiring routine morning vital signs and medication administration. C. A client who reported sudden onset of shortness of breath and chest discomfort. D. A client scheduled for a dressing change on a stable surgical wound. Answer: C. A client who reported sudden onset of shortness of breath and chest discomfort. This question assesses the PN's ability to prioritize client care based on urgency and potential for immediate harm. Sudden onset of shortness of breath and chest discomfort are critical symptoms that could indicate a life-threatening condition such as a myocardial infarction, heart attack, or pulmonary embolism. Clients experiencing acute changes in respiratory or cardiac status always take priority over stable clients or routine tasks. For example, delaying assessment for these symptoms could lead to irreversible damage or death. Always remember that acute changes in a client's condition, especially those affecting ABCs, airway, breathing, circulation, warrant immediate attention. Question 16. A client with a new prescription for warfarin, Coumadin, is receiving discharge teaching from the practical nurse, PN. Which statement by the client indicates a need for further teaching? A. I should avoid foods high in vitamin K, like spinach, while taking this medication. B. I will need to have regular blood tests to check my INR. C. I can take ibuprofen for pain if I get a headache. D. I need to be careful to prevent cuts and bruises, as I might bleed more easily. Answer: C. I can take ibuprofen for pain if I get a headache. This question focuses on medication safety and potential drug interactions, specifically with anticoagulants like warfarin. Ibuprofen is a nonsteroidal anti-inflammatory drug, NSAID, that can increase the risk of bleeding when taken concurrently with warfarin, which is an anticoagulant. Therefore, this statement indicates a need for further teaching. Avoiding vitamin K-rich foods, having regular INR checks, and being cautious about bleeding are all appropriate instructions for clients on warfarin therapy. For instance, taking ibuprofen with warfarin significantly increases the risk of gastrointestinal bleeding. Always educate clients to avoid NSAIDs when they are on anticoagulant therapy due to the increased risk of bleeding. Question 17. A practical nurse, PN, is preparing to administer insulin subcutaneously. Which injection site is most appropriate for consistent absorption? A. Deltoid muscle. B. Ventrogluteal area. C. Abdomen. D. Dorsogluteal area. Answer: C. Abdomen. This question pertains to safe and effective insulin administration. The abdomen is the most appropriate site for subcutaneous insulin injections due to its large surface area and consistent absorption rate, as it has a good blood supply and fat distribution. Other sites like the thighs and upper arms can also be used, but the abdomen is often preferred for daily injections. Muscles, deltoid, ventrogluteal, dorsogluteal, are for intramuscular injections, not subcutaneous insulin, and would lead to faster, less predictable absorption. Always remember that rotating sites within the same general area, e.g., abdomen, is also important to prevent lipodystrophy, ensuring consistent medication absorption. Question 18. A practical nurse, PN, is caring for an immobile client who has developed a stage 2 pressure injury on the sacrum. What is the most appropriate nursing intervention for this pressure injury? A. Apply a dry gauze dressing to the wound. B. Vigorously massage the reddened area around the wound. C. Reposition the client every 2 hours and use pressure redistributing devices. D. Use a donut cushion when the client is sitting in a chair. Answer: C. Reposition the client every 2 hours and use pressure redistributing devices. This question addresses the essential nursing interventions for managing and preventing pressure injuries. A stage 2 pressure injury involves partial thickness skin loss and requires interventions to relieve pressure and promote healing. Repositioning the client every 2 hours and using pressure redistributing devices, like specialized mattresses or cushions, are fundamental to offloading pressure from the affected area and preventing further skin breakdown. Dry gauze dressings are generally not appropriate for moist healing environments. Vigorous massage can further damage tissue, and donut cushions can actually concentrate pressure and worsen the injury. Always prioritize pressure relief and regular repositioning to facilitate healing and prevent new pressure injuries. Question 19. A practical nurse, PN, is providing education to a pregnant client in her first trimester about common discomforts. Which symptom should the PN emphasize as requiring immediate reporting to the healthcare provider? A. Nausea and vomiting. B. Leg cramps. C. Vaginal bleeding. D. Breast tenderness. Answer: C. Vaginal bleeding. This question focuses on client education during pregnancy and recognizing urgent warning signs. While nausea, vomiting, leg cramps, and breast tenderness are common and usually benign discomforts of the first trimester, vaginal bleeding is a critical symptom that requires immediate reporting to a healthcare provider. Vaginal bleeding during pregnancy can indicate serious complications such as miscarriage, ectopic pregnancy, or placental issues, necessitating prompt medical evaluation. For example, even a small amount of bleeding could be a sign of a problem that needs immediate attention. Always emphasize that any vaginal bleeding during pregnancy is abnormal and requires prompt medical assessment. Question 20. A practical nurse, PN, is administering an intramuscular, IM, injection to an adult client. Which site is generally considered the safest for most IM injections in adults? A. Deltoid muscle. B. Dorsogluteal muscle. C. Ventrogluteal muscle. D. Rectus femoris muscle. Answer: C. Ventrogluteal muscle. This question assesses knowledge of safe intramuscular injection sites. The ventrogluteal site is generally considered the safest and preferred site for most intramuscular injections in adults because it is free from major blood vessels and nerves, minimizing the risk of injury. The deltoid is suitable for smaller volumes, and the dorsogluteal site carries a risk of sciatic nerve injury, while the rectus femoris is not a commonly recommended IM site for routine injections. For instance, correctly identifying the ventrogluteal site by locating the anterior superior iliac spine and iliac crest ensures a safe injection. Always prioritize using the ventrogluteal site when large muscle mass is needed for IM injections in adults. Question 21. A practical nurse, PN, is conducting a home visit for an older adult client who lives alone. The client reports feeling lonely and isolated since their spouse passed away. Which nursing intervention is most appropriate to address this concern? A. Suggest the client watch more television to pass the time. B. Recommend the client move into a long-term care facility. C. Explore local community programs or social groups the client might join. D. advise the client to get a pet for companionship. Answer C. Explore local community programs or social groups the client might join. This question focuses on addressing psychosocial needs and promoting social well-being in older adults. Feelings of loneliness and isolation are significant concerns that can negatively impact mental and physical health. The most appropriate nursing intervention is to empower the client by exploring available community resources that foster social connection and engagement. Simply watching television doesn't address the underlying issue. Recommending a move to long-term care may be premature and not desired, and getting a pet may not be feasible or desired for all clients. Helping clients connect with local senior centers, volunteer opportunities, or social clubs directly addresses their need for companionship and purpose. Question 22. A practical nurse, PN, is reinforcing teaching about proper use of a metered dose inhaler, MDI, with a spacer. Which instruction is crucial for the client to understand for optimal medication delivery? A. Shake the inhaler vigorously only before the very first use. B. Breathe in slowly and deeply through your nose while pressing the canister. C. Exhale completely, then activate the inhaler while inhaling slowly and deeply through the mouth via the spacer. D. Immediately exhale after inhaling the medication to clear your lungs. Answer C. Exhale completely, then activate the inhaler while inhaling slowly and deeply through the mouth via the spacer. This question tests the PN's knowledge of correct metered dose inhaler, MDI, technique with a spacer, which is crucial for effective medication delivery to the lungs. The key steps for optimal delivery involve exhaling fully first to empty the lungs, then activating the inhaler while simultaneously inhaling slowly and deeply through the mouth via the spacer. This ensures the medication reaches the lower airways. Breathing through the nose or immediate exhalation after inhalation would reduce medication delivery. For example, if a client doesn't exhale first, their lungs are already full of air, making it harder for the medication to get deep into the airways. Always emphasize the importance of controlled breathing synchronized with inhaler activation. Question 23. A practical nurse, PN, is caring for a client who is NPO, nothing by mouth, for an upcoming surgical procedure. The client repeatedly asks for water due to a dry mouth. What is the most appropriate action by the PN? A. Offer a small sip of water to alleviate discomfort. B. Provide oral care with a moist swab or sponge. C. Explain that all fluids are withheld due to risk of aspiration during surgery. D. Offer hard candies or chewing gum to stimulate saliva production. Answer B. Provide oral care with a moist swab or sponge. This question addresses comfort measures for NPO clients while maintaining adherence to NPO status. When a client is NPO, no oral intake is permitted due to the risk of aspiration during anesthesia or surgery. Providing oral care with a moist swab or sponge is the most appropriate action because it alleviates the discomfort of dry mouth without violating NPO status or posing an aspiration risk. Offering water, hard candies, or chewing gum would all violate the NPO order. For example, simply explaining the NPO status without offering a comfort measure does not address the client's immediate discomfort. Always prioritize comfort measures that align with NPO restrictions. Question 24. A practical nurse, PN, is caring for a client experiencing an acute hypoglycemic episode. The client is conscious and able to swallow. What is the immediate priority intervention? A. Administer glucagon subcutaneously. B. Provide 15 grams of a fast-acting carbohydrate. C. Prepare to administer intravenous dextrose. D. Offer a complex carbohydrate like a sandwich. Answer B. Provide 15 grams of a fast-acting carbohydrate. This question focuses on the immediate management of a conscious client experiencing hypoglycemia, a critical nursing priority. When a client is conscious and can swallow during a hypoglycemic episode, low blood sugar, the immediate priority is to administer 15 grams of a fast-acting carbohydrate, e.g., 4 ounces of juice, regular soda, or glucose tablets, to quickly raise blood glucose levels. Glucagon or intravenous dextrose are used for unconscious clients or those unable to swallow. Complex carbohydrates are for follow-up once glucose levels stabilize, not for immediate treatment of acute hypoglycemia. Remember the rule of 15, give 15 grams of fast-acting carbs, wait 15 minutes, then recheck blood sugar. Question 25. A practical nurse, PN, is reviewing a client's medication reconciliation form upon admission. What is the primary purpose of medication reconciliation? A. To identify all medications the client currently takes to prevent errors. B. To determine which medications can be safely discontinued. C. To educate the client about all their prescribed medications. D. To verify medication allergies with the pharmacy. Answer: A. To identify all medications the client currently takes to prevent errors. This question highlights the critical role of medication reconciliation in client safety during transitions of care. The primary purpose of medication reconciliation is to create an accurate and comprehensive list of all medications a client is currently taking, including prescription, over-the-counter, and herbal supplements, upon admission, transfer, or discharge. This process helps prevent medication errors such as omissions, duplications, dosing errors, and drug interactions, thus enhancing client safety. While client education and allergy verification are part of medication management, the core purpose of reconciliation is this holistic medication list creation. Think of it as a thorough inventory check to ensure everything is accounted for. Question 26. A practical nurse, PN, is observing a new personal support worker, PSW, performing perineal care for a female client. Which action by the PSW indicates a need for further instruction? A. Cleansing from the least contaminated area to the most contaminated area. B. Using a new part of the washcloth for each stroke. C. Wiping from the anus towards the urethra. D. Ensuring client privacy during the procedure. Answer: C. Wiping from the anus towards the urethra. This question addresses proper infection control principles during perineal care, specifically in preventing urinary tract infections. When performing perineal care on a female client, it is crucial to wipe from the urethra towards the anus, front to back, to prevent the transfer of fecal bacteria from the anal area to the urethra, which can cause a urinary tract infection. Wiping from the anus towards the urethra significantly increases this risk. All other options describe correct and safe practices. Always remember the front-to-back wiping motion to protect clients from UTIs. Question 27. A practical nurse, PN, is caring for a client with a nasogastric, NG, tube inserted for gastric decompression. The PN observes that the tube is no longer draining effectively. What is the most appropriate initial nursing action? A. Remove the NG tube immediately. B. Irrigate the NG tube with sterile water or normal saline, as per physician order. C. Increase the suction setting on the wall suction unit. D. Reposition the client to the supine position. Answer: B. Irrigate the NG tube with sterile water or normal saline, as per physician order. This question focuses on troubleshooting an occluded nasogastric tube used for decompression. If an NG tube is not draining, the most appropriate initial action, after checking for kinks, is to irrigate the tube with sterile water or normal saline as per physician order or facility protocol. This helps to clear any blockages from gastric secretions or food particles. Removing the tube or increasing suction without first attempting to clear it is premature, and repositioning to the supine position may not resolve a blockage and could increase aspiration risk if the tube is truly blocked. Always attempt to clear a blocked NG tube with irrigation first, following established guidelines. Question 28. A practical nurse, PN, is teaching a client about self-administration of subcutaneous enoxaparin, Lovenox, injections at home. Which statement by the client indicates proper understanding of the injection site? A. I will inject the medication into the muscle of my upper arm. B. I should inject it into the fatty tissue on the side of my abdomen, at least 2 inches from my belly button. C. I will inject it into my thigh, ensuring I aspirate before pushing the plunger. D. I can inject it anywhere on my body as long as it's under the skin. Answer: B. I should inject it into the fatty tissue on the side of my abdomen, at least 2 inches from my belly button. This question assesses proper technique for subcutaneous injections, specifically for anticoagulants like enoxaparin. Enoxaparin should be injected into the subcutaneous fat, typically in the abdomen, at least 2 inches from the navel, or in the fatty tissue on the outer aspect of the thigh. This site allows for consistent absorption and minimizes bruising. It is not an intramuscular injection, upper arm, and aspiration is generally not recommended for subcutaneous injections, especially with anticoagulants, due to the risk of hematoma. Injecting anywhere is incorrect as specific sites are preferred for safety and absorption. Always emphasize using the abdominal area for these injections, ensuring consistent fat tissue and avoiding blood vessels. Question 29. A practical nurse, PN, is preparing to administer medication to a client. The PN notes that the client's name on the medication administration record, MAR, does not exactly match the name on the client's wristband. What is the PN's immediate action? A. Administer the medication, then report the discrepancy after. B. Ask the client to state their full name and date of birth. C. Withhold the medication and verify the client's identity with another healthcare professional or system. D. Compare the room number on the MAR with the client's room number. Answer: C. Withhold the medication and verify the client's identity with another healthcare professional or system. This question focuses on medication safety and the right client principle of medication administration. A discrepancy between the client's name on the MAR and their wristband is a critical red flag for misidentification and a potential medication error. The immediate and most appropriate action is to withhold the medication and thoroughly verify the client's identity using at least 2 identifiers, e.g., full name and date of birth, and cross-reference with another reliable source, such as another nurse or the electronic health record system. Administering the medication without resolving the discrepancy is unsafe, and simply asking the client might not be sufficient if there's a systemic error. Always ensure client identity is confirmed before any medication administration. Question 30. A client is experiencing mild anxiety about an upcoming diagnostic procedure. Which therapeutic communication technique would be most effective for the practical nurse, PN, to use? A. Don't worry, everything will be fine. B. Tell me more about what makes you feel anxious about this procedure. C. Many clients feel this way, it's completely normal. D. Here is some detailed medical information about the procedure. Answer: B. Tell me more about what makes you feel anxious about this procedure. This question addresses therapeutic communication skills, specifically for a client experiencing anxiety. The most effective technique is to use an open-ended statement that encourages the client to express their feelings and concerns in detail. This approach validates their emotions and helps the nurse understand the specific source of their anxiety, enabling targeted support. Phrases like "don't worry" or "it's normal" are dismissive and block further communication. Providing immediate detailed medical information might overwhelm an anxious client, and it is better to first understand their specific fears. Always invite the client to elaborate on their feelings to truly address their underlying concerns.